Good afternoon, everybody. I'm Sayukta from Bladder Wellness Team. I'm sure all of you must be keeping good health. OAB or overactive bladder is a frequent and sudden urge to urinate that may be difficult to control. The condition is common and distressing and may have a large impact on the quality of life. In this month of World Continence Week, let's unite to raise awareness about incontinence related issues and its impact on the life of people living with it. To throw more light on the subject and guide us on what's right for diagnosis and treatment of OAB, today we have with us renowned Dr.R Srivathsan. Dr. Srivathsan is Senior Consultant Urologist from Apollo Hospital Chennai. Dr.R Srivathsan is having rich experience in the field of urology and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to you, Dr.R Srivathsan. Hope you are doing good, sir.
Very well. Thank you so much.
That's great. So, Doctor, today, as we are into the World Continence Week, and the whole purpose of having this session is to spread awareness over World Continence Week and overactive bladder. So, first of all, I would like to begin with asking you, what is the significance? Why there is a need to celebrate World Continence Week?
Right. So the International Continence Society usually celebrates a week of World Continence Week and so forth. This is to create awareness amongst the public with regards to the existence of this condition, which is usually undiagnosed and usually does not come to the forefront. People tend to manage. It's in fact, to be fair, called as a new silent epidemic because people feel shy many a times to express their symptoms. Many of the people do not go out because of the feeling that they may leak urine and so many other factors, social issues, and so forth. So this is rightly called as a silent epidemic, and this is the reason why the International Continence Society wanted to create an awareness so that people understand that it's not a very unique problem. In fact, it's actually a very common problem. As you age, there is very high chance that you may experience it as well. So it's just to create awareness amongst the people that it is just a medical condition which may or may not require treatment, but at least you need to approach your doctor to understand what's happening and why you need some treatment in order to exist in that situation. You need not have to continue with the same problem ever to treat it and make sure that you get rid of it as well.
Exactly. So the bottom line is then don't suffer in silence. It's a very common thing. Please speak about it. And as we said that today we are going to talk about overactive bladder. First of all, we would like to know, doctor, what an overactive bladder is.
So overactive bladder, as the name suggests, basically what we are trying to say, it is becomes slightly overactive. That is, it tends to do more than what it is supposed to do. Now, this is reflected in the symptomology of having some urgency. So urgency is a very important symptom that usually the patient present with. Now, in addition to urgency, which can vary from a bit of a couple of times urgency to frequency, or it can be very, very bad to the extent that every 15 to 20 minutes you can feel the urge of passing urine. So the severity varies. In addition to urgency, again, you may have the frequency of urination where you may have to go again and again. This may occur either in the daytime or in the nighttime. Nighttime is even more troublesome because it does not let you sleep well and so forth. In addition to all these issues, you may also have what is called as an incontinence, which is basically urine leak. It could be related to urge incontinence, where you want to go and you try to rush to the bathroom, and in spite of you trying to rush, you do leak a bit of urine before you reach the toilet. Now, these are the basic common symptoms of overactive bladder. Overactive bladder is a very big umbrella term. It actually does not denote anything. It just denotes the symptomology. It is not a disease per se. It's just a common term which has been proposed to include all the patients who have this kind of a symptoms. Now, these symptoms are called as irritative LUTS, which is irritative lower urinary tract symptoms, which includes urgency, frequency, urge incontinence, and so forth. So this may be due to various reasons, and that is the thing that we need to get to the bottom of which will let us treat the cause. and thereby, we can try to cure the patient of the OAB as well.
Right. You very well said that it's an umbrella term. It covers so many things. And these symptoms are what actually defines OAB or an overactive bladder. Now, as you said, it's important to see what's causing OAB. We would also like to know what are the major causes? What are the things that are mostly responsible for an overactive bladder?
Okay, so in broad terminologies, overactive bladder is basically classified into neurogenic or non-neurogenic. So neurogenic is basically if you have some neurological issues, for example, a slip disc or a irritative disc starting, which is a very common thing that can occur at old age, including any kind of a trauma, injury, spinal cord issues, so many other factors. So these are all originating from the spinal cord to brain, and these are called as neurogenic overactive bladder, where that there is an issue with the nervous transmission of stimuli, which is causing the overactive bladder. There is also another entity which is called as a non-neurogenic overactive bladder, and this is the most common thing. We do not know that the nerves are involved in causing the overactive stimulation. So basically, what happens when we pee? Basically, what happens is that the bladder is like a pouch which can fill large quantities of urine. Now, as is due to various social reasons and so forth, when our bladder gets filled up with the urine, the bladder sends stimulation to our spinal cord, which is transmitted to the brain, saying that, okay, the bladder is now quarter full, half full, and so forth. Now, we generally tend to ignore this information that is sent to our brain because we are working, we are doing some other thing, we are involved in, for example, I'm doing surgery, so obviously I'm going to ignore it. Now, there reaches a limit above which the bladder puts immense pressure on the brain, saying, yeah, that's we are reaching the limit of the storage quantity in the bladder. And that's when it starts sending you impulses from the brain saying that, okay, you need to pee real quick in the next, 5 to 10 minutes. And that's when you have this kind of urgency that occurs that you need to go to the bathroom. Now, this happens only when a certain critical limit of storage is exceeded. Now, if this occurs even at a very lower limit of storage, for example, 100 ml. So the quantity that is achievable by a bladder varies from person to person, but generally runs into sometimes even liters. You can even hold up to a liter of urine. So when this stimulation starts occurring at a very, very early stage, even before you start to fill your bladder with a couple of mils of 100 mils of urine, and that is when you have an altered pathway where even a small quantity of urine is stimulating your bladder from into the spinal cord to the brain, giving you false sensation that you need to rush to the bathroom to pee. But actually, when they do rush to the bathroom, they hardly pee about 100 to 200 ml. Now, we do not exactly know the reason of this kind of what we call as a pseudo transmission of impulses from the bladder to the brain. Now, there can be either a local cause in the bladder, for example, some irritation in the bladder, which is the positive origin of this stimulation, like, for example, infection, an inflammation, probably a stone sitting in your bladder. It could be some kind of blood clot or anything sitting in your bladder. All the things are organic causes which is sitting in your bladder and irritating your bladder, and thereby sending you stimulation again and again, even with lesser quantities of urine. Now, but there are also other causes other than these organic causes, like some kind of what we call as an interstitial cystitis, where there is a swelling in the layer that is containing the bladder. So the bladder is actually lined by a very unique layer of proteinaceous material, because the urine that is stored inside the bladder should not be absorbed back into the system. That is to expel the toxic material outside, not back into the system. So we have a kind of like a bridge between the urine and the bladder so that the absorption does not occur. Now, if there is some defect in the bridge or there is some gaps in the bridge, the urine will seep through that cellular layer and get into the layers of the bladder and irritate the bladder again. Now, this is another hypothesis that is said that this could be the origin of the increased stimulation of the nerve cells in the bladder. Or generally itself, the bladder nerve cells may be hyperactive, where without even stimulation, they start sending you impulses like pain. So this could be also another reason where it could be the cause. So there are various hypotheses, but many a time we are not able to give a scientific explanation as to why the overactive bladder occurs. And that is where the entire conundrum of overactive bladder being such a great issue lands it.
You have explained it so well, as if a 3D, imagining was going on. So yeah, now we at least know what are the causes that are responsible for an overactive bladder. Now, the thing is that whatever symptoms you have mentioned, doctor, these symptoms also come with age. These symptoms also come when patients suffer from diabetes. These symptoms are quite common in men, especially when they have enlarged prostate issue. Now, my question is, if a person is ignoring these symptoms, saying that I'm aging, so I'll have to live with it, or I'm a diabetic patient, so I'll have to live with it. These are the consequences that, this comes with it. So, what that person should do? What's your suggestion to those people?
That's a very common tendency in India, where everything is put upon age as to the suffering is due to the aging process itself. So what I would request to the people listening to this is that aging gracefully is a very important thing, and you should not be suffering in your age process, especially when you are older. Also, there are also other issues associated with it. For example, an elderly patient who's having OAB with urgency and frequency is going to rush to the bathroom often. And most of the cases of fracture that we get in our emergencies are elderly people trying to get to the bathrooms. So this implies a lot, because financially, medically, as well as health-wise, this is going to be a huge setback to the patient. Because, for example, if he has a hip fracture or a neck of femur fracture, they are going to be either have to be operated, or they have to be in a bed for a couple of months and so forth. That's going to be a huge setback in terms of quality of life and so forth. So it doesn't mean that this alone is a reason for treatment. Also, there is a called your quality of life. The quality of life affection by overactive bladder is very, very bad. See, if you are not going to sleep well because of nighttime frequency, if you are going to have issue where many of my patients who come to me say that, doc, I'm not able to visit this place because I'm frightened to travel in a bus. I'm not able to visit because I may have to, I have to stand in the wedding ceremony for a couple of hours, and I'm unable to do that. Should I wear a diaper? So these are all very pertinent social and familiar issues that come into play. And many a time when you have a urinary leak and you smell of urine, that is also becomes like a huge social factor. So I think overall the awareness is actually improving. No longer are the days where people, you just think about that it's just a part of the aging process. So I think the tendency is slowly changing, but yes, the awareness is more important in it should penetrate all levels. What I see is a city practice, where I do not know about the second tier cities and the towns, but I think it should penetrate on all levels to understand that this could be a possibility of a cure that can be achieved in order to give a better quality of life.
Right. And as we said in the beginning, that please don't suffer in silence. If you have an issue, please go and consult your urologist. Don't just associate everything with aging, etc. Because even if it's because of your age, it will have a solution. If there is a problem, there has to be a solution. So please go and consult your urologist. That's important. One more thing, doctor, that I would like to know and understand is that what should patients do to reduce these symptoms of overactive bladder? Anything that we can do by ourselves?
Okay, so most of my patients, they do two things. One is they drastically cut down on the intake of fluids. That is the commonest thing that they do. They will have their coffee and tea, but they will stop drinking water. So that's actually not a great thing to do, because I do understand the concept behind it. You reduce the amount of urine, then you're going to reduce the number of times that you need to pee. But for a general health, it is essential that we take about 2.5 liters, especially in a hot country like India, especially in a city like Chennai, where it's quite humid, you're going to sweat a lot. So at least 2.5 liters of fluids per day is of very, very must that a person to take. So in these conditions, if you are going to cut down on your fluid intake, that's going to create other issues, including kidney problems as well as stone issues and so forth. So I would not advise that. The one thing that you can do is that cut down on your caffeine intake. So caffeine is a definite bladder irritant, because caffeine is secreted into the urine, and that's how it's excreted after metabolism. And that's a known bladder irritant. It has been proven in various studies to irritate the bladder wall. So it is essential that you, for example, there are many people who take many a cup of coffee during the daytime and evening. So if you can cut it down to at least maybe a cup or 1.5 cups per day, and especially not during the night time, evening time, cut down on your evening intake of tea and coffee. Tea also has a little bit of caffeine, so that's also supposed to, irritate the bladder. So if you can do that, that will go a long way in reducing your symptoms. Also, the way you take your fluids. For example, if a person is suffering from nocturnal problems like nighttime increase in frequency, urgency, what I tell my patients is usually keep your fluid intake in the daytime, and after 6 o'clock, try to cut down on your fluid intake to a minimum possible the amount that you take with your food and your medications, and try to avoid the rest of the fluids like milk. Some people have a tendency to keep a jug of water nearby and keep drinking in the night every time they pee, and thereby increasing the number of times they pee as well. So all those things of slight lifestyle modifications will go a long way in this thing. Many a times it is unavoidable that you may land up in getting a situation where you will have to pee. In those patients who are elderly and have these problems, we do advise that they stay close to the bathroom as well, so that they don't have to rush in the dark and have a fall or something like that. In addition, obviously, if it is too bad and they are like every 10 to 5 to 10 minutes, then definitely a diaper would help them in the night. However, I do not recommend a diaper on a long-term basis because it has its own problems as well.
Right. So these are some of the things that we can do to keep a check on an overactive bladder. Another thing is, doctor, if at all we need treatment, if we need something which is not in our control or something which we can't help, but definitely will go and seek the advice from the doctor. So what are the treatment options available?
Okay, so there are various stepwise approach that we utilize in order to treat a patient with overactive bladder. It depends on a few factors, including patient factors, basically patient factors. One would be taking in consideration what age group are the patients from. The second would be what are the other medical conditions are they suffering? Would they require, for example, as you rightly said, a diabetic patient may have a polyuria, which is completely different from a OAB, which will be misdiagnosed as a OAB. He is just putting out a lot of urine, and the sugar control is the maximum possible treatment for him. That alone may control his symptoms as well. So there are a lot of issues here. Make sure that all his medical conditions, everything is up to. There are also certain medication which puts out more urine. For example, a cardiac patient is going to be put on a diuretic, for example, a Lasix or a lacilactone, and that is going to increase your urine output. So these are certain things that we need to look into before you put a patient on a medical therapy. So the most common treatment that we give are medications, tablets to control the frequency and the urgency. So we have several groups of drugs which has come over the last few decades. The latest being what is called as mirabegron, which is like a wonder molecule, which has all the goodness of the previous molecules without much of the side effects as well. So we have several molecules which has gone through the last 4 decades. The most common of which is the anticholinergic group of drugs. They are very effective in controlling the number of times and the urgency feeling. The only problem is this, there are certain drugs in the first generation which cannot be given in the elderly. There are certain drugs in the newer generation which can cause constipation, which is already a big problem in the elderly. So these are the two complications that we generally get while prescribing this medication. Otherwise, it's a wonderful medication and it cuts down your symptoms by more than 80%. The newest drug, which is the mirabegron, canceled out that side effect profile of the previous generation drugs, but it's equally effective in controlling the symptoms up to 80 to 90%, which is excellent because when you have a patient who is suffering so much, even 30-40% improvement is really exciting for them. But an 80% improvement is really good. The only problem arises because many times you do not know the cause of the overactive bladder is the duration of the treatment. We do not know how long should you give this medication as well. I generally, as a principal, try it out. The minimum duration that I give is for a month, and then slowly cut down on the doses. Try to see how the bladder responds to the previous month of medication, and then take it forward. Whether you will require a long-term medication, usually not, but there are people who may require it for a longer term than usual.
Okay. So the good part is that good treatment is available, which can actually reduce these symptoms by 80 to 90%, which is really good. Doctor, what should a patient do if he or she thinks of having OAB?
Oh, so if they understand that the symptoms of OAB are this and they would do that, they first need to, depending on the age group of the patient, obviously, they usually it affects the elderly more so, and they should really consult their urologist. If that is not possible, you have to consult a general doctor as well to at least rule out the basic medical issues and so forth. Many of them are first-time diabetics and so forth. The other
Oh,
thing that other thing that they can do is to maintain what is called, for example, you have an appointment with a urologist. Your urologist is going to demand a certain number of tests to be done, obviously. One would be a urine routine, which just to make sure there is no evidence of infection and so forth in your urine. And second would be a basic minimum would be an ultrasonogram that makes sure your bladder, there is no irritant factor, there is no mass, no stone and so forth. In rest of before that, if you have an appointment with the urologist is going to ask for what is called as a bladder diary. So that you can maybe maintain it and give it to him. He will be more than happy to go through it to understand what is the pattern of urination. So what is exactly bladder diary? It's just a diary that you maintain of what fluids that you have taken in and how much urine, how many frequently you have put the urine out. So it's basically like noting of the time, how approximately how many ml you have taken and how many ml you have peed. So this diary is very essential because many a time you may be having what is called as a for example, many times they say we get up about 10 times in the night, and many times it is not 10 times because we feel, oh, of course, I had to get up so many times. It's like, it seems like 100 times I've gotten up. So that one, you actually get to know what exactly is happening. The second point is that if you get, for example, 10 times in the night, I need to know how much you pee every 10 times, all these 10 times. For example, if you pee 10 ml, 20 ml, 30 ml, the diagnosis is different. If you're going to pee 100 to 200 ml every time that you pee, that means you're putting out a lot of urine in the night. Now, that is called as a diabetes insipidus, which is another variation of diabetes, which is related to the kidney and other issues. So that also has to be ruled out because if you put out more than half of your urine in the night, then it means that there is something wrong with your kidneys. So there are a lot of factors, that information that you can garner with a simple bladder diary that will help the doctor in taking it forward in your treatment as well.
Now, doctor, as urinary system involves 2, 3 organs, it involves kidneys, of course, as they work as filters. It involves bladder as that's the storage, we can say. It also in men involves prostate. Now, if somebody is having OAB, can it affect the other organs associated with it?
So OAB is basically a disease of the bladder. Okay. It may be because of any other reason, the kidney irritating the bladder or the prostate irritating the bladder or anything. But OAB as a whole is a benign disease. It's not basically this thing. Though a cancer in the bladder wall can irritate the bladder and cause OAB and is incidentally diagnosed. But other than that, OAB as a process, even though it is irritating and nagging to the patient, does not affect you in the sense like it's not going to kill you or something like that. It's a benign disease. It's not going to affect you in the long run per se, though it is kind of irritating to have this kind of a disease as well. But it is not going to change into something, notorious or drastic as well. Its maximum that it's going to do is going to, increase the number of times you're passing more as well. That is the only thing that's going to happen. However, there are certain conditions that if it left untreated can lead to the shrinkage of the bladder and so forth. For example, if you have OAB, which is because of a tuberculosis of the bladder, over a period of time, that's going to shrink and make your bladder very, very small. And that's going to affect you in the long term. So avoiding or not evaluating the reason for OAB, for example, you have a neurogenic OAB, for example, you have a spine issue causing the overactive bladder, you're going to ignore it. So I can tell you an incidence of a patient who walked into my OPD with prostatic symptoms. So OAB is quite common to both male and female. There is no major difference between that female has more or male has more or something like that. So it was a very typical prostatic symptoms and so forth, but more of a frequency urgency kind of a pattern. So when we evaluated, I started him on prostatic medication. He actually had worsening of symptoms, which is very, very rare. We usually have a betterment of the symptoms. So
Right.
when I evaluated him neurologically, he had what is called, what we call as a normal pressure hydrocephalus. There was pressure inside the CSF buildup, which was causing the frequency urgency to be felt. So treating that condition by giving diuretics and all those things actually relieve the symptoms. So it is just, as I said, an umbrella term. If you do not find out the reason, at least try to find out the reason, rule out basic reason for OAB, you may land up in soup because of missing out on those conditions as well. So that is one of the most reasons, important reasons why we evaluate OAB per se. However, OAB is very, very benign. If it is idiopathic, what we call the reason unknown, it is basically very, very benign. It will irritate you, but it will definitely not kill you.
So, what I can make out from what you just said is that it's not life-threatening, but it's not good to ignore the whole thing. You need to go and consult your urologist, right? We'll pick a few questions from our viewers, Doctor. Parul Shinde is asking, why does it feel like I have to pee after I just peed?
Okay, so there may be two reasons for that. It depends on your age, Ms. Parul. So basically, it could be because there is some urine staying back inside the bladder. You have not completely emptied your bladder. So once you have not completely emptied your bladder, you may feel that your urine is still staying back and you are not satisfied with the amount of urine that you have passed. So this has to be evaluated because this can lead to future infection, stone formation, and so forth. So you need to do an ultrasound to make sure that there is actually the urine is staying back or not. But even without the urine staying back, because of the irritation of the bladder, you may still feel the sensation that you have to pee always. And then you need to find out what is the reason for that and treat it accordingly. The basic minimum is that you have to rule out infections. You have to do an ultrasound to find out if actually the urine is staying behind or not.
Right. So it's important to diagnose the cause, the root cause, and a urologist will do it for you. Yash Sharma is here, doctor, asking, I have a bladder problem and I'm planning to have a surgery, but I'm worried if my entire bladder will be removed.
It's a very non-specific question. I do not know what bladder problem he has and what surgery has been planned for. So if there is a bladder issues because of prostate and you're going to plan for a prostate surgery, so probably the most common surgery that we do is what is called as a TURP, where we endoscopically remove the prostate. Then you do not have to worry, your bladder is going to be intact. They're just going to remove the block to the bladder so that you can pee better. But otherwise, if there is something else, for example, a bladder tumor or something that they are going to cut and remove, I'm not sure I can answer the question without more information.
Yes, in that case, Yash can actually go and ask, your doctor because they have set the line of treatment for you. Now, doctor, one thing I would like to ask you is that does the treatment options also have some surgical options as well for overactive bladder? Because why I'm asking this question, because Ravina Patel is asking, what are the risks and benefits of surgery?
Right. So basically, we do not have any surgical procedure to increase the decrease the symptoms or something like that. We have what is called as a Botox injection into the bladder, where just like how you put for the cosmetic this thing, we can inject the same botulinum toxin into the bladder, and that is will decrease the amount of irritability and the contractibility of the bladder, thereby relaxing it, make you help you hold more urine and so forth. That is one of the procedures that can be done. It's quite safe. It gives you a lasting effect till about a year. More than that, we'll have to wait and watch. One. Second thing, for example, if the volume of the bladder is very, very less, it's a very small bladder, about 100 ml, and that is the reason for your OAB, then we can do certain surgical procedure in order to increase the volume of the bladder. There are a lot of methods to it. One easiest method is what we call as an hydrodistension, where we instill saline, slowly try to enlarge the bladder from inside. If that fails, then we will do a surgical procedure to increase the volume of the bladder by putting in small bits of your small intestine as a cover up for that, and thereby increasing the volume of the bladder. So these are the main surgical procedures that we do. In addition to this, if the cause of the overactive bladder is because of neurogenic element, then we have what is called as a sacral nerve root stimulation for the decreasing the overactive bladder symptoms, where we put a small electrode into the spinal cord nerves stimulate it, thereby reducing your sensitivity of your bladder and thereby giving you lasting response.
Okay. We have Bharat with us asking, Doctor, what vitamin helps with bladder control?
There is no evidence of vitamin therapy helping you as a general in bladder control, but vitamins in general is important for your healthy lifestyle and so forth. But there is no specific vitamin which is related to this thing. When it comes to neurogenic causes, I think B6, B12. If many of you are vegetarians or something like that, the lack of B6, B12 is immense, especially in the elderly. So you need to have your supplementation of B complex with a multivitamin tab.
Right. Initially, doctor, you said that there are a few things that we should avoid, like excess of coffee, tea, especially after urine, and excess of water. I mean, a limit is okay, but not too much of that. Is there anything that we should include to have a healthy bladder? I mean, it's just an extension to what Bharat has just asked.
Okay, so other than this lifestyle modification, like little bit avoidance of caffeine and everything, another thing that I would like to mention and people generally don't consider is smoking or any use of tobacco products, which also get excreted through the urinary system. So that is again an irritant which is often forgotten. So if you are I would advise to avoid tobacco per se. Second is alcohol. Again, alcohol is excreted through the urine. So all this irritants is going to irritate the bladder and increase your symptoms. If you're normal, then it is fine. If you're already a patient of overactive bladder, all this is going to add up to your symptoms and problems and so forth. So all these things is to be try to avoid as much as possible. In other than that, no other supplements or anything is going to improve or decrease your symptoms per se. However, you can there are two, I wouldn't say medications, but there is one medication which is a cranberry extract. Okay, cranberries are supposed to prevent urinary tract infection and is supposed to be good for bladder health. So you can try either natural cranberry, though the amount of cranberries you need to take is quite high, or there are natural supplements like cranberry extract that is available in the market. You can take those supplementation that is good for your bladder. The second thing is that a drug, but this is not to be taken as a supplement. This has to be prescribed by a doctor. What is called as a pentosone polysaccharide. Now, as I said just before in my talk, that there is a layer on the mucosa of the bladder, which is a protective layer of the bladder. Now, it is made of what is called as GAGs, glycosaminose glycans. Now, this pentosone is a sugar like that. So we can try giving this sugar molecule which can coat the bladder and improve your symptoms. So this is a very commonly used drug in a condition called interstitial cystitis, which is a very painful bladder syndrome with overactive bladder. So this is works really very well. So you should ask your doctor, the urologist that you are consulting, whether this is valid for your condition per se. So this is another molecule that you need to know. Other than that, there is no other supplement or lifestyle modification which is going to improve your symptoms per se.
And doctor, as we are moving towards the conclusion of this session, anything that you would like to add on which we missed, or any takeaway note that you would like to share with our viewers?
Okay, so as I said in the initial part, it is really a silent epidemic, and I am actually happy that the awareness has come a bit. Many people do approach us as to like, I have this issue and this is really getting to me and so forth. But even many of our grandparents have come and asked me, I'm not able to lift my child because there is some urinary leak and so many other things, grandchild and all those things, play with my grandchild also. So this is definitely improving. But what they generally try to do is try to manage till it is unmanageable. They try to wear some kind of a diaper or a cloth to avoid the smell, and all those things and get away with doing that. What my simple request to people who are having at least mild to moderate symptoms of overactive bladder, which I've enumerated, to just get a consult from your local urologist to understand if there is anything significant to be associated with it. If they have ruled out the basic causes and it's just an idiopathic overactive bladder, your symptoms can be relieved with excellent medication with very least amount of side effects. So don't be worried that, okay, it's not treatable or anything like that. You can have a good quality of life. You can have a good time with your family, attend your family functions and so forth without much ado if you just have a basic consult. And these consultation do not require expensive tests and so forth to determine the cause as well. The very basic minimum number of tests are the ones we do. Especially in males, prostate is a very major reason for overactive bladder. So treatment of the prostatic issue itself will lead to resolution of the overactive bladder as well. So this is something, again, they need to take into cognizance. OAB in the female is slightly more difficult to deal with, but then again, it is treatable as well.
Right. So why suffer in silence when you have treatment options available, when you have urologist available, when you can get advice from them, and treatment is also there. Thank you so very much, Dr.R Srivathsan, for your valuable time, sir. And it has been quite an informative session for our viewers. We really look forward for many more such sessions in coming times. Thank you so much.
Thank you so much. Yeah, bye-bye.
And we would also like to thank our viewers for an excellent participation. And for more information on how to diagnose, manage, and treat overactive bladder, please stay active on Overactive Bladder. I mean, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, on Insta. Thank you so very much. Goodbye. Good day.